My outline for today, I'm going to be talking about the definition, the epidemiology, etiology and pathophysiology, risk factors, diagnosis, possible differentials, prevention, case study. I have a few questions at the end, and I'll showcase my references. So the definition of sudden infant death syndrome, it is when there is a sudden death of an infant, usually below the age of 1, which despite thorough case investigation, the whole situation remains unexplained. These tests usually include performing a complete autopsy of the infant and examining the death scene as well as reviewing the clinical history. Usually, or all the time, this disorder or this diagnosis is usually by exclusion. There are other names to it, such as crib death and cot death. For the epidemiology, is more likely to occur in infants between the ages of 2 and 4 months, and it could reach up to 6 months. It is more common in males than females, and it is the leading cause of infant mortality between 1 month and 1 year of age of 1 year of age in the United States, and it's usually below 1 per 1,000 births, and is more common in African Americans and Native Americans, and is not common usually, but infants have a 20 times increase in dying from SIDS when compared to the risk of other causes of death until the age of 18. So let's say such as motor vehicle traffic accidents, firearms, drugs, and overdose, as well as suicide. For the etiology and pathophysiology, with the etiology of SIDS being unclear, some evidence suggests that it may be caused by different combinations of external as well as internal issues. The whole situation of this leads to hypoxia, and usually 90% of cases of SIDS occurs during sleep. For the intrinsic factors and the intrinsic issues, usually it's brainstem disorders that are the main concern, especially ones that include abnormalities in the serotonin pathway. This results in respiratory problems, such as upper respiratory reflex issues, as well as other concerns in infant inability to wake up during the night, as well as elevated blood pressure it can cause. And some of the external issues could be such as sleeping in a prone position, or if the mother is exposed to smoking or alcohol during pregnancy, and we'll talk about the risk factors in a bit. And having an unsafe environment for the infant. Let's say that the infant is surrounded on his crib or her crib by stuffed toys or stuffed animals that they could bring closer to their face while they're asleep. This could cause them to suffocate and not be able to move the stuffed animal or toy from their face. Genetic factors also play a role, specifically for the cardiac ion channels, such as CSN5A, KCNQ1, KCNH2, as well as RYR2. And for the skeletal muscle sodium channels, such as SCN4A, and the monoamine oxidase A, the MAO gene, and partial deletions of complement C4, as well as interleukin-10 promoter gene and testis-specific Y-like genes encoding for heat shock proteins. Now, the mechanism of the increase in SIDS risk with the prone position is not known, but some studies have suggested that the prone position predisposes the child to suffocation, as well as having an increased heart rate and prolonged QT interval. And some studies also suggested that the control of cardiac function may be abnormal in infants at risk for SIDS. And infections could also cause SIDS to occur. Now, as for the risk factors, we can divide them into 3 subcategories: risk factors affecting the mother, risk factors affecting the infant, and risk factors of the environment around the infant. Now, for the mother, it's usually a young maternal age below the age of 21. Poor prenatal care, they didn't follow up with their physician for their prenatal checkups. Having a low socioeconomic status, being a single mother, maternal smoking and alcohol consumption. They noticed that there's an increase in SIDS cases, usually around New Year's Eve, in the US for mothers who smoke and drink alcohol. And there's also a risk factor being the short period between pregnancies and lack of experience in raising children and dealing with their well-being and their growing up phases. As for the infant associated risk factors, The two main concerns are sleeping in a prone position and low birth weight, being, like we mentioned, the age between 2 to 4 months where it's most common. If the infant was sick between the last 24 to 48 hours, studies have also shown that having a twin could increase the risk factors. Let's say if both twins shared the same placenta and so on. If the infant was male, like we mentioned, because it affects mostly male, and if there's head covering or body covering, because that increases the body's heat, also resulting in suffocation. And for the environmental risk factors, we have sharing a bed with someone else, sleeping in a separate room where people can't notice that the baby is choking, sleeping on soft surfaces, bedding accessories like toys or stuffed animals, overheating, as well as a crowded house. Now, like we mentioned, to diagnosis, it's a diagnosis of exclusion. Usually the forensics team analyzes the body of the infant during autopsy as well as the place of death. They also rule out children maltreatment and abuse to make sure that there wasn't any killings of this infant. As for a differential diagnosis, it's a very long list. It ranges from general to blood to heart, lungs, kidney, GI tract, liver, pancreas, adrenal, and brain. I listed them here as if anyone would like to go over them, because these are the main causes of concern around this. For the differential diagnosis, one of the differentials we have to exclude is brief resolved unexplained events. The old name being apparent life-threatening events. ALT was thought to lead to SIDS. With that being said, there are different factors that affect the areas, and especially this is what we use to separate them both. Most SIDS patients don't experience sleep apnea or acute events before their death, as opposed to the ALTE. Other differences also include that SIDS occurs usually 80% of the time between 12 a.m. and 6 a.m. That's the phase where the parents would be asleep and the baby would also be asleep. They can't really focus on the baby as much, as opposed to ALT, which usually occurs 82% of the time between 8 a.m. and 8 p.m. Because like we mentioned, it could happen because of acute events. SIDS usually occurs between 2 to 4 months, while ALT occurs usually in 2 months or less. With all the differences mentioned, ALT can be used to predict SIDS, since it involves near-death experiences to all infants. For prevention is key from all of this, especially during the pregnancy. The mother should not consume alcohol or shouldn't smoke or use recreational drugs. The mother should also be adherent to her prenatal care and go with her follow-ups. And after pregnancy, the infant should not sleep prone, and they should sleep supine. And make sure that there are no pillows or blankets or stuffed animals in the crib with the baby. And the first 6 months, the infant should share a room without sharing a bed. The infant should also use a pacifier. The baby should develop a technique known as tummy time. Tummy time is where they lay on their stomachs under supervision to make their neck muscles stronger. So if that happens or occurs during sleep, they can help themselves and turn their necks if needed or lift their necks. And their vaccine should be up to date, and that is something very important. This is a case study and done in 2019 but published in 2020. It is to see the awareness of sudden infant death syndrome among Saudi Arabian women. The study, like we mentioned, wanted to assess their knowledge, and the authors also established how there aren't many papers about this incident due to the fact that there are strict faith-related observances. They did a cross-sectional survey in Arabic done online to different regions in the kingdom. They used 363 responses from the 384 that they collected, adding up to 94.8% of the total. 232 out of the 363, which is around 64%, heard about SIDS and its prevention, while the remaining 36% have. Although such a low number reported that babies should sleep supine, while compared to the 5.5% who believe babies should be on their stomachs. Overall, they concluded that there is good understanding amongst the women and that children should be supine when being asleep. With that being said, the study also suggests more women should be aware of SIDS as a very sudden issue that could happen to any infant at any time. Thank you all for listening to this presentation. Do you have any questions for me?
طيب, thank you again, Mazen, for your good presentation and covering the topic. Floor is open for question.
Yeah, Doctor, is it okay? I have a few questions of my own for the students to
Go
test
ahead.
their knowledge. Would anyone like to read this first question?
Yeah, I will read it. Okay, so a 4-month-old African American infant is brought to the pediatrician for a well baby checkup. He was born at term through a normal vaginal delivery and has been well since. His 4-year-old brother has sickle cell disease. He's exclusively breastfeed and receive vitamin D supplements. His immunization are up to date. He appears healthy. His length is at the 70th percentile and weight is at the 75th percentile. Cardiopulmonary examination is normal. His mother has heard reports of sudden infant death syndrome being common in his age group and would like to hear more information about it. Which of the following is the most important recommendation to prevent his condition? A. Use soft bedding and pillows for the baby. B. Have a baby sleep in spine position. C. Avoid feeding the baby close to bedtime. D. Have the baby sleep with the parents. I think the answer is B.
Yes, Sultan, thank you. The answer is correct. Although we mentioned that the baby should also share a room with someone, the most important thing is to have the baby lie in supine position and be up to date with their immunization.
Mhm.
Next question, if anyone would like to read it.
I can read it.
Go ahead, Tala.
Okay, so cribs themselves do not cause SIDS, but sleep environmental factors such as soft sleeping surfaces, toys, and laying supine can increase the risk of SIDS and other causes of infant deaths. That's true?
Yes, thank you so much, Tala. And for the final question, who would like to read this?
I can do it.
Go ahead, Anna.
Vaccines, immunizations, and drugs cause SIDS. No, that's false.
Thank you so much. The truth being that there's no evidence that vaccines lead to SIDS, and all babies must see their healthcare providers regularly for checkups. They might also receive their vaccinations on time, especially recommended by their healthcare providers. This concludes my presentation, and these are my references. If anyone has any questions for me, feel free to ask.
Good job, yeah. Any question for you, colleague?
Thank you.
طبعا we have to be very careful in saying sudden infant death. You really must exclude any other etiology. As you know, autopsy may not be feasible in everywhere. Religious reasons, cultural reasons might not allow like a comprehensive autopsy after death to identify really the reason if it was going to be found. But full histories now, if we have a family who had touched a sudden death, we must rule out any metabolic disease that contribute for what previously was reported as a sudden death, metabolic more error of metabolism or metabolic disease that can cause sudden death in certain situation. One other thing that you have to consider is the rebreathing. I mean, soft pillows or mattress might. I mean, suffocation is yes, the risk, but rebreathing again when the baby breathe against closed area, whether his head was within that soft pillow, and then he start to rebreathe, and CO2 will accumulate until he go into CO2 narcosis and death afterward. And that's what can contribute to a sudden death with the soft pillow. So already an eye for this age group must be kept by the parents. Not to sleep with the parents, true, but within the room, or at least they have an eye on whenever they are sleeping. If there is any movement or baby was not well over the night, they will not. They will be alert about it as soon as they or as soon as possible. طيب. I think by this we conclude, we finished before time. Basically, the presentation were like short on that, but it was well covering the topics, the targeted topic. Any question in general for the whole topics that we presented today for any of your colleagues, the presenters? If not, otherwise, I would like to thank you all. And do you have anything afterward, Lanoon?
We have a break and then we have 2 lectures, inshallah.
يعطيكم العافية everybody, and then we'll see you inshallah.
يعطيك العافية دكتور.